Hello and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which operates the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service for people with Medicare. Every state has a SHIP program. In Wisconsin, you can get free and unbiased help with Medicare from local SHIP counselors. You can download the slides to this presentation by clicking the link in the YouTube video description. This project is supported by a grant from the Federal Administration for Community Living. This program will provide an overview of Medicare and is divided into 6 parts. You can find this information in greater detail in your Medicare and You handbook, which is mailed to people with Medicare and can also be found on the Medicare.gov website. For easier understanding, you are encouraged to view the parts of this series in order. Welcome to Part 5 of this educational series. In this section, you'll learn about prescription drug coverage, including Medicare Part D and Wisconsin SeniorCare, as well as Medicare's annual open enrollment period. Remember that there are 2 ways to receive Medicare Part D prescription drug coverage, either through a standalone Part D plan or through a Medicare Advantage plan that includes drug coverage. And don't forget about Wisconsin's prescription drug assistance program called SeniorCare. We'll get to that in a few minutes. Medicare Part D is Medicare prescription drug coverage. If you choose Original Medicare and you want prescription drug coverage, you must choose and join a Medicare prescription drug plan. You usually pay a monthly premium. These plans are run by private companies that contract with Medicare. Again, Part D coverage is provided through Medicare prescription drug plans and through Medicare Advantage plans with prescription drug coverage. There are certain times that you can enroll in a Part D plan. Your first opportunity to enroll is your initial enrollment period. This period starts 3 months prior, month of, and 3 months after starting Medicare. There is also an annual open enrollment period, which is from October 15th through December 7th each year for coverage starting January 1st of the following year. And for people who are already enrolled in a Medicare Advantage plan, there is a Medicare Advantage open enrollment period from January 1st through March 31st. Again, this is only for people already enrolled in a Medicare Advantage plan. There are also special enrollment periods. In certain circumstances, such as moving out of your plan's service area, you may be eligible for a special enrollment period that would allow you to change your Medicare prescription drug coverage outside of other enrollment periods. The costs for Medicare Part D plans include premiums, deductibles, copays, or coinsurance. The costs vary by plan and change every year. In 2026, the Part D monthly premiums range from $0 to $106.60 per month. The 2026 national average monthly premium is $34.50. The deductible limit for 2026 is $615, which means the deductible cannot be higher than that. Some plans may not have a deductible or may have a lower deductible. Copays and coinsurance vary per drug, per plan, and per pharmacy. So your cost for prescription drug coverage will depend on the plan you choose, which prescription drugs you take, and whether you go to a pharmacy in your plan's network, and whether you get extra help paying for your drug costs. In a few minutes, we'll discuss how to find and compare plans. Please note, people who have higher incomes may pay an additional amount on top of their monthly premiums based on their level of income reported in their tax filing. This applies to only about 5% of people with Medicare. The Part D late enrollment penalty is something you will want to avoid. If you do not enroll in Part D during your initial enrollment period and you do not have other credible drug coverage, you may incur a late enrollment penalty. The penalty is 1% of the average national monthly premium for every month you delayed enrollment, and it will be added to your monthly premium if and when you enroll in a Part D plan, and it will continue as long as you are enrolled. Credible coverage is other prescription drug coverage that is expected to pay on average at least as much as Medicare Standard Part D coverage. Veterans drug coverage and Wisconsin Senior Care are considered credible coverage. Some types of employer coverage are also considered credible coverage, but it is important to ask. This graphic sums up the Medicare Part D costs for 2026 during each coverage phase. These amounts generally change each year. In 2026, if your plan has a deductible, it cannot be more than $615. You will pay the full cost for your medications until you reach your deductible. During your initial coverage period, you will pay either a copay or a coinsurance amount for your medications, which will be no more than 25% of the cost of the drug. Some plans may have low-cost generic drugs with very low copays during this initial coverage period. If your total out-of-pocket drug costs reach $2,100, you reach the catastrophic period, and your prescription drug copays are $0 for the rest of the calendar year. Copays for covered insulin are capped at $35 for a 1-month supply. Medicare Part D plans cover prescribed medications, medications that are included in a plan's formulary, but not all medications are covered by all plans, insulin, needles, and syringes for the administration of insulin. The medication must be for medically prescribed use in order to be covered. The law excludes certain medications from coverage under Part D. The following items are not covered by Medicare Part D: medications that are not on a plan's formulary, non-prescription or over-the-counter drugs, drugs that are not approved by the Federal Drug Administration or the FDA, vitamins and minerals, cough medicine, medications for erectile dysfunction, and drugs for cosmetic purposes, including weight loss or weight gain or hair loss. Also, please note that off-label use of prescription medications is not covered by Part D. For example, if a doctor prescribes a medication for a condition, but the FDA does not approve the use of that medication for that condition, then the drug will not be covered, even if it is on the plan's formulary for use with other conditions. The Medicare prescription payment plan is a payment option that works with your current drug coverage to help manage your out-of-pocket costs for drugs by spreading them out across the calendar year. Signing up earlier in the year gives you more months to spread out your drug costs. Your payments might change every month depending on what prescriptions you get filled, so you may not know what your exact bill will be ahead of time. Most likely to benefit if you have a high drug cost. Anyone with a Medicare drug plan or Medicare health plan with drug coverage can use this payment option. All plans offer this payment option, and participation is voluntary. Next, we will cover in Part 5, Wisconsin Senior Care Prescription Program. Another option for prescription drug coverage is Wisconsin's Prescription Drug Assistance Program, called SeniorCare. This program is available to Wisconsin residents age 65 and older who are U.S. citizens or have qualifying immigrant status. There is no monthly premium, only a $30 annual application fee. SeniorCare is considered credible prescription drug coverage. Your annual income determines your SeniorCare level of coverage. People with lower incomes at SeniorCare Level 1 have no deductible for their prescriptions, and they pay copays of $5 for generic drugs and $15 for brand name drugs. For additional information or for an application, contact SeniorCare online or call 1-800-657-2038. This table shows the different levels of SeniorCare. It shows the income limits, and it shows the annual out-of-pocket expense requirements and benefits. Next, we will cover in Part 5 the annual open enrollment period. The annual open enrollment period for Part D and Medicare Advantage plans runs from October 15th through December 7th each year. These plans are one-year contracts that are effective from January 1st through December 31st. The plans can change their plan details each year. They are required to send you a notice of change each year by the end of September. Use the annual open enrollment period to review your plan and compare it to other available plans, and make sure you will have appropriate coverage in the new year. If you enroll in a new plan, your new coverage will begin on January 1st. The best way to find and compare plans is to use the plan comparison tool known as the Plan Finder on the Medicare website at www.medicare.gov. For assistance with Medicare questions or with plan comparisons, you can call Medicare directly at 1-800-633-4227. You can also get assistance from the Wisconsin SHIP or Medigap helpline at 1-800-242-1060, or from your local SHIP counselors. You can find your local SHIP counselor by contacting your county Aging and Disability Resource Center or by calling the SHIP number. If you are comfortable using the computer, visit Medicare.gov and click Find Health and Drug Plans. This will bring you to Medicare's plan comparison tool known as the Plan Finder. The Plan Finder will walk you through the steps to find and compare plans. By entering your specific medication information, your pharmacy preference, and your zip code, you will be able to get an estimate of your annual cost with each of the plans available in your area. You can enroll in a plan online through the Medicare Plan Finder or by calling Medicare, or you can contact the plan directly. You can find the plan's contact information on the Medicare Plan Finder. Again, if you don't have access to a computer, or if you'd like assistance with finding and comparing plans, be sure to call one of the resources provided on the last slide. This concludes Part 5 of the Welcome to Medicare series. I hope this information has been helpful. The next section in this series will discuss help for people with limited income, protect yourself and prevent fraud, review, and resources. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service that provides free and unbiased help to people with Medicare. If you have questions about Medicare, you can call the Medigap helpline at 1-800-242-1060 or visit the Wisconsin Department of Health Services website to find a local SHIP counselor near you.